Autism or autoimmune disease is a disorder of a group of developmental disorders called medical language auto-spectrum disorders, autism spectrum disorders, ASD, which appear at breastfeeding age before a child reaches the age of 3. Although the seriousness and symptoms of autism vary from case to case, all subjective disorders affect a child's ability to communicate with their surroundings and develop mutual relationships with them. Estimates show that 6 out of every 1,000 children in the United States suffer from autism, and that the number of diagnosed cases of this disorder is constantly increasing. It is not yet known whether this increase is the result of the most effective detection and reporting of cases, an actual and real increase in the number of autistic patients, or the result of both factors. Although there is still no cure for autism, intensive treatment and early diagnosis can make a noticeable and serious difference in the lives of children with the disorder. Major difficulties for autistic patients. Children with autism also suffer almost certainly from difficulties in 3 key evolutionary areas: mutual social relations, language, behavior. As children age towards adulthood, part of them can become more able and willing to mix and integrate into the surrounding social environment, and can exhibit fewer behavioral disorders than those that characterize autism, with some even succeeding in a normal life or lifestyle, close to normal and normal life or lifestyle. In contrast, others continue to have difficulties in language skills and in mutual social relationships, so that their attainment increases their behavioral problems. A section of children are slow to learn new information and skills, and others are naturally intelligent, or even higher than other ordinary people. These children learn quickly, but experience communication problems in applying things they have learned in their daily lives and in being affected by different situations. Very few children with autism are self-educated and have unique exceptional skills, particularly concentrated in a particular field, such as art, mathematics, or music. Symptoms of autism. Because the signs and symptoms of autism vary from patient to patient, each of the 2 different children is likely to behave with the same medical diagnosis in very different ways and to have completely different skills. In most cases, however, cases of autism are extremely serious, characterized by an absolute inability to communicate or to establish mutual relationships with other persons. Symptoms of autism appear in most infant-age children, while other children may grow up and develop quite naturally during the early months or years of their lives, but suddenly become sealed off, hostile, or lose the language skills they have acquired up to that point. Although each child suffers from symptoms of autism, showing their own printing and patterns, the following symptoms are the most common for this type of disorder. Disorders in social skills. The patient's symptoms are as follows. He doesn't respond to his name call. No more direct visual contact. He doesn't seem to hear his update. Hugs are refused or deflated. He doesn't seem to realize other people's feelings. He seems to like playing alone, expecting in his world his own person. Problems with language skills. The following are the main symptoms of language skills difficulties. Speech starts at a later age compared to other children. It loses the ability to say certain words or sentences it once knew, make a visual connection when he wants something. He speaks in a strange voice or in different tones and rhythms, or he speaks in a singing voice, or in a sound that looks like a robot. He cannot initiate a conversation or continue an existing. Behavioral problems. The main symptoms of behavioral problems in autism are frequent movements, such as vibration, circling, or waving of hands, are carried out. He develops habits and rituals that he always repeats. He loses his knife when there is any change, even the simplest or smallest change, in these customs or in rituals. Be durable. He is dazed and dazed by certain parts of the purposes, such as I spin and torque. Causes of autism. Among the most important causes that may lead to autism are genetic disorders. Researchers have discovered several genes that are likely to play a role in causing autism, some of which make the child more susceptible to disorder, while others affect brain development, and the way brain cells communicate between them. Any gene responsible for an individually may be responsible for a number of subjective conditions, but it's a large part of health problems are the result of genetic and environmental factors combined, and this may be true in the case of autism. Researchers have recently examined the possibility that a viral infection or environmental contamination may be a catalyst for the emergence of autism. Other factors recently under research and study include problems during childbirth and the immune system's role in all aspects of autism. Some researchers believe that amygdala, a part of the brain that acts as a detector of risk conditions, is one factor to stimulate the onset of autism. Research has shown that male children are 3 times more likely to become self-infected than females. Families with an autistic child have a higher likelihood of giving birth to another child with the disease, and a common thing is that parents or relatives with an autistic child themselves suffer from certain disorders and certain developmental, evolutionary, or even subjective behaviors. Children with certain medical problems are more likely to become self-inflicted. These medical problems include Fragile X syndrome, tuberous sclerosis, neurological disorder known as Tourette syndrome, epilepsy. Researchers tend to believe that late-age fatherhood may increase the likelihood of autism. Very comprehensive research has shown that children born to men over 40 years of age are 6 times more likely to become self-infected than children born to parents under 30 years of age. From the complications of autism, what comes? Inability to succeed in studying, social isolation, inability to live independently, tension, abuse, and violent handling. The pediatrician conducts regular developmental and developmental examinations to detect delays in the child's development. In the event of symptoms of autism in the child, you can go to an autism specialist who, in collaboration with a team of other specialists, thoroughly assesses the disorder. Since autism ranges from very many degrees of severity to the severity of its symptoms, self-diagnosis can be a complex task, as there is no specific medical examination to detect an existing case of autism. Although the initial symptoms of autism appear before the age of 18 months, the final diagnosis is sometimes only when the child reaches the age of 2 or 3, when there is an imbalance in development, delays in the acquisition of language skills, or an imbalance in mutual social relationships. Early diagnosis is very important because early intervention, especially before a child reaches the age of 3, is a very important element in achieving the best prospects and opportunities for improving the situation. To date, there is not a single treatment that is equally appropriate for all sufferers. In fact, the range of treatments available to autism patients that can be adopted at home or in school is surprisingly diverse and multiple. Autism treatment includes behavioral therapy, speech-language pathology, educational therapy, drug therapy. There is no way to prevent autism, but early diagnosis helps improve an autistic person's behavior.